Welcome everybody to an e-learning course entitled Environmental Change and Related Diseases. I am Dr. Dudsadee Muenhor, acting as a module facilitator. In this module, you will receive a pre-test before taking the module and then a post-test after taking the module to assess your knowledge. The module is divided into 7 topics as shown in this slide. I am quite sure that some of you here are familiar with the term environmental change. Environmental change is the change or disturbance of the environment caused by human influence or ecological processes. Environmental change, for an example, changes in precipitation, temperature, and air qualities. This slide shows roots of environmental change. Environmental change occur in different ways like air, soil and water pollution, loss of forests, volcanic eruption, and global warming. Environmental change is occurring around the world and having numerous effects on the earth right now. The key health impact of environmental change are summarized in this slide. Extreme events such as flooding and earthquake lead to water-related diseases like cholera. Vector-borne infections result in malaria and dengue, and waterborne infections lead to cholera and leptospirosis. As you can see that the majority of the key health impact of environmental change are infectious diseases, so I will focus on the infectious diseases caused by environmental change for the following topic. Environmental change may increase the risk of infectious diseases in 3 ways. That are the first, by increasing the temperature under which many diseases and their carrier form. The second, by more stressing and changing habitats. And the third, by creating migrations. Infectious diseases influenced by environmental change mainly are vector and waterborne diseases. So, I will talk about these diseases in the next following slides. What are vector-borne diseases? VBDs are infectious diseases that are transmitted by infected arthropod species such as mosquito and fleas. VBD risk may increase due to expansion in geographic range of vectors. An example of North America, as you can see in the right-hand figures, there has been a northward expansion of tick that can transmit infectious disease. Shortening of pathogen incubation periods and disruption and relocation of massive human populations. Dengue is a well-known mosquito-borne disease. Scientific studies have reported the data on dengue and environmental change that are: the first, temperature is a critical factor in dengue transmission in the areas. The second, warmer global temperatures can increase the transmission range. And the last, longer and warmer mosquito season could result in the comeback of dengue infections in the United States. Another well-known example of mosquito-borne disease is malaria. Researchers have reported the data on malaria and environmental change that are expansions of mining and other active industry such as fishery and oil drilling can increase the malaria infection. The second, deforestation and road building often disrupt forest and river system, increasing the habitat for malaria-carrying mosquito. And the last, warming in Africa could lead to the spread of malaria. Increase in water temperature, precipitation frequency and severity, and evaporation, transpiration rates, as well as change in coastal ecosystem health could increase the incidence of water contamination, resulting in increased waterborne disease risk. Cholera is a waterborne disease. The researchers have scattered the data on cholera and environmental change that are the first, warming ocean may result in an increase in cholera and other infections. The second, the scientists reported a significant positive relationship between ocean surface temperature and the Vibrio occurrence. And the last, the more severe heat waves and more frequent and more severe flooding will increase the cholera infection. Everyone is affected by environmental change. Factors affecting ability to respond to health impacts of environmental change, as shown in this slide. For example, living in areas vulnerable to environmental change, such as mountainous, polar, and coastal areas, as well as the megacities. The group most at risk for environmental change, as shown in this slide. For example, the poor, the elderly, children, and pregnant women. To solve environmental change problem, the World Health Organization Board endorses a work plan for solving environmental change problem. This includes partnerships, awareness raising, science and evidence, as well as support for implementation of the public health response to environmental change. In this slide, a video on lesson summary will be presented to summarize what did you learn from the module. It will take about 1.5 minutes. The last 3 slides for my module provide the list of references used in my module. All of the references are available in university libraries or websites. I hope you will enjoy the module and really hope that the knowledge and experience obtained from the module will be applied for the full benefit of your organization and country. Thank you very much for your attention.